I often get asked what the difference is between a food allergy and being food intolerant. Food allergy and food intolerance is part of, well, they both are adverse reactions to food. The difference is that food allergy is an immune-mediated response to a food, a part of a food or an ingredient as part of a food, whereas a food intolerance doesn't involve the immune system. So the signs and the symptoms of food allergy and food intolerance can be quite different. So we often, as an example, think of food allergy as can be quite severe. So some people, for example, who are allergic to peanuts can have a very severe and immediate immune reaction to consuming a peanut. So that can involve their mouth swelling up and their airways, and it can be serious enough that if they don't get immediate help, they could actually die. So that's called an anaphylactic shock. Whereas someone with food intolerance would not have such a severe reaction to food. They wouldn't have an immune-driven response in that way to food. So their symptoms are often less severe. They often involve the gastrointestinal tract or the digestive system, and so they can have signs that could be tummy aches, bloating, diarrhea. So the signs and symptoms are quite different, and the way that people present are different, but the two do get quite confused. So a lot of people say that they're allergic to a food when actually they're not really allergic to it. They're actually intolerant, or they have a sensitivity to it. It's very difficult to truly state what the prevalence of food allergy is, and much more difficult to actually know what the prevalence of food intolerance is. If we look at population statistics in New Zealand, it's estimated that food allergy is prevalent in about 1.5 to 3% of the adult population, maybe around 6% of children. It does vary across population groups, and it also varies a lot depending on how it's been diagnosed. So it's quite difficult to diagnose food allergy. What you often find is a lot of people report they have food allergy, but in fact, if they are systematically investigated and they go through the proper diagnosis, often they don't actually have food allergy. So it's estimated that about 38% of the population say they have a food allergy or food intolerance, whereas in reality the amount is much less than that. It's really important to be properly diagnosed with food allergy, and it's very important that it is managed correctly, because removing certain food items from the diet, particularly in children, can mean that they become susceptible to malnutrition or not getting adequate dietary intake. The literature would suggest that there is an increase in prevalence of both food allergy and food intolerance. It's quite difficult to really define, because for us to really look at prevalence, we have to make sure that the numbers that we're looking at is true food allergy that has been properly diagnosed. But population studies in both Europe and Australasia would show that there is an increase in food allergy and food intolerance. There are a number of hypotheses why we have an increased prevalence of food allergy. One of the hypotheses is the hygiene hypothesis. So because we live in much more hygienic environments these days, our immune systems aren't primed from an early age to be able to deal with some of the larger proteins that we consume in food, such as cow's milk and wheat and eggs. In the past, when we lived in less hygienic conditions and I suppose babies got dirty, their immune systems were primed from an early age, because they would have more viral infections and bacterial infections, and also be infested with worms. And these things, obviously, young babies don't have these days, which is a good thing. But the downside of that is that their immune systems stay immature for quite a long time, and therefore they're more likely to develop a reaction to, or an adverse food reaction to, some of the bigger proteins when they're introduced into their diets. Some of the other reasons are also around early infant feeding. So in the past we had recommendations that advised us to delay the introduction of some of those foods that are allergenic, such as milk and wheat and eggs, into infants' diets. And it's thought that by delaying them, we could have sensitized infants more to those foods, so that when they were introduced to them after the age of 1, they were more likely to be allergic to them. So our new guidelines in New Zealand are that we introduce them around 6 months of age, and the best thing is to introduce them while you're still breastfeeding. Breastfeeding is really important in terms of protecting infants and young children against food allergy. The main foods that cause food allergy are, there are 8 foods in fact. So there's nuts, particularly peanuts, which are in fact a legume, not a nut, tree nuts, seafood, particularly shellfish, cow's milk, eggs and soy products. So food allergies, the signs of food allergies are quite different depending on whether they're immune mediated, in terms of whether they're quite an immediate immune reaction or whether it's a slower immune reaction. So the very immediate immune reaction or immune response that's mounted by our immune system is often the signs are very immediate and very severe. So they can be anything from an anaphylactic shock or to getting a very strong red rash, which is called urticaria, or in some cases, mouth swelling or throat swelling. And then the less kind of immune response, or the less severe immune response, would be some of the more gastrointestinal responses, which may be diarrhea or vomiting. To actually diagnose food allergy, there's a number of steps that have to take place. So you need to go, people need to go actually see an allergist or an immunologist and have what we call a series of clinical tests, which may involve a skin prick test or a certain type of blood test, which may look at some of the immune markers in the blood to certain food allergens. Then after that testing, often people go on what is called an elimination diet. So they put on a very restricted diet of foods that are known to have very low allergenicity. And that may be things like lamb and rice and pears, so quite a restrictive diet. And then there is a food challenge. So foods are added back into the diet in a very systematic way over a period of time. And I suppose the body is then challenged with those foods to see whether somebody reacts to them or not. So it's quite an intensive, long process to determine food allergy. Obviously, in people who have very immediate or severe reactions, the reaction will happen quite quickly and the diagnosis will be quite quick. But for those that have a sort of longer or slower type reaction, it can take a number of months and sometimes up to a year to diagnose somebody with food allergy. So people with food intolerance, because they don't sometimes get such specific signs and symptoms, can take quite a long time to diagnose their intolerances. So often they can have a similar sort of systematic approach to their diagnosis, but they may need to keep a food diary and keep a track of signs and symptoms when certain foods are consumed, or they may be put on an elimination style diet and have foods added back into their diet again in a systematic way, and then a response seen to see whether they're intolerant to that food. But it can take quite a long time to diagnose. One of the things with food intolerances versus food allergies is that food intolerances can occur at different times. So some people may be able to tolerate a food quite well, but then they may get run down, for example, or stressed, or have a lack of sleep, and they then may not be able to tolerate that food during those times. So it can be quite difficult then to pinpoint exactly what food is causing them to have say, for example, diarrhea or tummy bloating. Food allergies and food intolerances really need to be managed with somebody who specialises in that area. So first and foremost, to diagnose food allergy, people need to go and see either a clinical allergist or immunologist. And then if they're going to have any alteration of their diet, they should really see a clinical dietitian, so a dietitian who is registered to practice in New Zealand. The gluten-free explosion, or the gluten-free popular diet that we have now, has been popular in New Zealand for, I suppose, the last sort of 5 years. it is a reasonably easy diet to follow, and it's become, I suppose, popular because gluten has been put down to being responsible for, many signs and symptoms for people with food intolerance. And there are many more gluten-free products obviously now on the market. So going gluten-free, as I say, is very popular, but again, not everybody really needs to be gluten-free. They only need to be gluten-free if they've been shown to have gluten sensitivity or gluten intolerance. There is a lot of myth around the gluten-free diet. Obviously, people with celiac disease have to adhere very strictly to a gluten-free diet. But many people put themselves on gluten-free diets because they say that they feel better, they're not as bloated, they feel more comfortable on a gluten-free diet. But one thing people have to be careful of is that many gluten products, or gluten-free products I should say, that are now on the market aren't particularly healthy. So what's happened is that wheat-based products such as bread and cakes and biscuits have just been replaced with gluten-free flours, and so those food products are still very high in fat and sugars, and so going gluten-free doesn't necessarily mean for a healthy diet. The really important thing with food allergy and food intolerance is to get a proper diagnosis and make sure that you're managed properly and that you consult a dietitian.